Hello, I'm going to go through the answers to the questions for Booster 1. And so here we go. It's a review of all the systems. So I hope it was helpful to you. I'm reading from another screen. So what is the study of the structure of tissues called? And that's histology. Really common question. So remember that one. Which type of tissue is found in the breast? And that would be areola and adipose. Areolar tissue, I think of like Aero, the chocolate with all little bubbles in it. It's like bubble wrap, and it's around your different organs to keep them packed. Because you look in a A&P book and everything's nicely put in there for you so that you can see everything, but actually in reality it's really messy in there. But around each organ is this areolar tissue, and the adipose is for warmth and protection and padding. So some of us have got more adipose than others. So that is a really common question about areolar and adipose tissue. So one on skin and how many layers in the epidermis, and I think you know by now there's 5. I learnt mine by saying, come let's go see Grandad, from the top. Come let's go see Grandad. That's corneum, lucidium, granulosum, spinosum and Grandad germinativum, or the basal layer. So there's those 5 layers, and it's from the basal layer or the germinativum layer that the mitosis takes place, and it travels up through the 5 layers, and by the time it gets to here it starts, the keratinization process takes place, because by the time it gets here there's no cells in it and it's dead. Otherwise you'd be really hurting when you touched your nail, and that takes a month, doesn't it, to travel up. Okay, so the next question is, how would you recognise Leuconychia? Now that is a question that the sports students won't get because it's about nails, but this is a good tip, is that like leukemia is to do with your white blood cells. Anything with LEU means white, and one of the answers on here is white spots on the nail, so you know it's that one. That's an easy one to remember. Another one that could come up is the air spaces between the cells of the medulla help give the hair and its sheen. So remember that one. It's a nice popular one that they choose. Again, the sports students won't get it, so you haven't got to worry about that. But any of you could get this. What is osteoporosis? And osteoporosis, you think of it as an old person's disorder or disease, and it's when the bones get very brittle and they break easily. People can get it at various ages though. Some poor people get it when they're quite young, but it's usually thought of as an older person's disorder. Let's have a look. One of the answers as well was inflammation of many joints, and that would be rheumatoid arthritis then, if they asked that, because rheumatoid, it spreads over the body like a rumour. So whereas osteoarthritis would often be, maybe you get it in your hands, or if you're a sports injury in your legs, usually people as they're older they start getting arthritis where the break or the fracture's been mending. But with rheumatoid arthritis, that is an autoimmune disease, and that can affect anybody at any time. So they're the ones to remember. Osteoporosis is brittle bones. Osteoarthritis is where it can be wear and tear, or an accident can cause it, and some people get it from because they're very, very unfortunate, but sometimes overuse of our hands we get osteoarthritis. And then rheumatoid arthritis is the one that spreads like a rumour, and it can affect all your joints, and you see people with really bad crippled joints, and poor loves, that's quite horrible. The next question, function of the skeletal system, and you've got various questions here. To send and receive messages, well, we know that, isn't it? And the other one is to store calcium and form red blood cells. So your bones, one of its jobs, it's got a few jobs, but one of it is to store calcium and form red blood cells. And the red blood cells can come from any of the long bones. And your long bones can even be one of your fingers here, your phalanges. They're classed as long bones because they're longer than the width. Okay. What's interesting about the formation of the red blood cells is that it's actually your kidneys that tell your that tell your bones to produce the blood cells. They get a message, but that's something that you haven't got to worry about. My thing disappeared. My screen disappeared. Anyway, it's back. The elbow joint. What sort of joint is that? Well, that would be a hinge joint. One of the choices here was a pivot joint, and we think of the pivot joint, that's pivoting, and that is the top two bones in your neck, and they've got a special name. They're so special, they've got their own name. That's the atlas and the axis, and they are the pivot joints. But the one for your elbow or your knee is just like a door, it's a hinge. And then the next question is, which of the following muscles flexes the elbow? And you've got a choice here of brachioradialis, flexor carpi, ulnaris and radialis, and your triceps. So which one flexes your elbow? Well, it must be a brachial. It's this muscle here. Under here you've got your tricep, and when that contracts, that lengthens this one, and this contracts to make your arm, so that your arm can go out. And then this one is flexing. So you've got your biceps, and this is the brachioradialis. The other choices were all on your lower arm. The carpi muscles are here. So flexor carpi muscles are at the bottom here. Triceps is obviously under here, but think of flexing like Popeye. If you said flex your muscles, you do this. So this is flexing, and that's extension. Circulatory. In which vessel does deoxygenated blood travel from the heart to the lungs? Well, blood goes away from the heart by an artery. It's always going away from the heart, A for artery. So it's going to have to be the pulmonary artery, because that's the one that's the deoxygenated blood has come in, and it's got to go up to the lungs to catch the oxygen and then go back into the heart to be pumped round. What is the function of an erythrocyte? So the erythrocyte is to transport oxygen as hemoglobin. So that's the red blood cells, which have got these little cone shapes in the middle, like donuts. To clot blood, if they ask the question which clotted blood, you'd think of thrombocytes. And that's another popular one. The lymphatic system, which of the following hinders the flow of lymph? And that is infection. Infection would hinder the flow of lymph. Which of the following statements is incorrect? And that's where you really need to read it properly. Which of the following statements is incorrect with regard to the function of the right lymphatic duct? So it's got drain from the right arm, well it does. Drain from the right side of the chest, and it does. Drain lymph from the right side of your head, and it does. But then it says drain lymph from the right leg. Well, it doesn't. The right lymphatic duct just does this bit here, your head, down here, and your arm. So it's drain lymph from the right leg is the answer, because they asked what is the one that's incorrect. So watch that. Nerves. Which part of the brain is responsible of subconsciously controlling posture? Well, there's your cerebrum, the cerebellum, the pons varioli, and the medulla oblongata, and the answer is the cerebellum, because you think of the bell. I've done this before, but the bell is for balance and posture. So cerebellum, it's a nice, easy way to remember that. How does the sympathetic nervous system affect the heart? Well, if you remember, the parasympathetic is like the slow parachute coming down. That's the parasympathetic. Therefore, the sympathetic is the one that G's you up. And so the answer could only be, from the choices here, accelerating the action of the heart. The endocrine system. What is the function of the parathyroid glands? And the parathyroid glands are like 4 dots on the thyroid, and they control your blood calcium levels. And this is where it's just amazing, because the blood passes through these 4 little dots. And if your body is too acid, then you need alkaline. So what your body will do is take out alkaline from other parts of your body, because your blood must have a good balance. The pH must be good in your blood. So what it will do is take the calcium, which is an alkaline, out of your bones and put it into your blood, so that because that's the important thing, because you could get your bones, you could get arthritis, osteoporosis, but you'd still live. But if you get problems with your blood, you're really in trouble, aren't you? So your body will read through your parathyroid like a little testing station, if you like, and think, oh dear, there's too much acid, we need some more calcium, need to be alkaline. Take it out of your bones, because once it's in your bones, it doesn't just stay there. It moves. It's a movable feast. It comes in and out. It's remarkable. Which endocrine gland is known as the master gland? And that's the pituitary, isn't it? And that is the size of an almond, right in the middle of your head, in the middle of your brain, and it controls all your hormones virtually. There is more to the hormone system than the master gland, but it's got that title for a reason. It kicks in the thyroid, your adrenals, your the women's ovaries and the men's testes are all affected by that. The growth hormone is in there, so if people are too tall or too short, that's because of the endocrine. What's going on in the pituitary. Milk let down when you're breastfeeding the baby, the start off of the uterine contraction for a woman having a baby, that begins in the pituitary. I know, it's amazing, isn't it? So okay, this is another popular one. Where is the prostate gland found? And that is surrounding the upper part of the urethra. We've got our kidneys, which are cleansing our blood, and the excess comes out as urine. And so from the two kidneys, we've got two ureters that go to the bladder, and then there's one urethra, like there's one urethra Franklin, and that goes to the outside world. And if a man has his prostate is around it anyway, that's where it belongs, say that was the urethra, but if it becomes enlarged, it presses onto it. So you could imagine you'd want to keep going to the loo because it's pressing on the urethra. And it's short, the urethra is short in women, which is why women are more prone to cystitis and getting bacterial infection going up into the bladder. So what is mastitis? Mastitis is inflammation of the breasts. And if you've ever had a baby, then you'd know about that one. It's not very comfortable when you're feeding a baby. It's like they're sucking on a blister, actually. That's how painful it is. Where does the majority of food absorption take place? Well, it starts in the mouth, the carbohydrate, and it goes into the stomach. The stomach also absorbs as well, but most of it is taken up from the small intestine. And it's amazing. Within your small intestine, these projections called villi that have got lots and lots of well supplied with blood vessels. And as the food goes through and it gets smaller and smaller and smaller, it then leaves your small intestine and goes out into your body, because that's what you want, that's what you're eating for, to feed your body. All the nutrients and the goodness goes out there, and then from your small intestine it goes down, and the waste goes into the large intestine or the colon, and then it's on its way out. And so the majority of food absorption takes place in the small intestine. Where does the digestion of protein begin? Well, that's in the stomach. Yeah. Respiratory. What is the function of the alveoli? And the alveoli, as you breathe in, you've got your trachea that goes to your bronchi, and then there's the bronchioles, which are like it's like trees, upside down trees, and which is just how, because trees help us to breathe, you can imagine these trees. So that's the bronchioles, and the bronchioles get smaller and smaller, and they go to the alveoli, which are richly supplied with blood vessels, and they are linked to the lungs, and then to the blood supply, and then from there the blood takes it to the heart, so that you're breathing in oxygen, and it goes into your system that way. And some poor people, their alveoli is thick with a mucus, and they can't breathe because then the oxygen can't get through to your body, and cystic fibrosis, for instance, and they have to be patted on the back and cough up because their alveoli is charged up with mucus and the oxygen can't get through. So it's got a really important job, and it's the exchange of gases, which is oxygen and carbon dioxide, between the lungs and the rest of the body. So that's the circulatory system and the respiratory system. Yeah, it's the link between the two. What is the function of the larynx? We think immediately that it's to help in voice production, don't we? But here, because you've got different questions, it says it's to act as a passageway for air between the pharynx, which is within the throat, and the trachea. So that's what it is for this question. Urinary. Be nice if you got this one. What is meant by micturition? The passing of urine. There, don't forget that one. And the last one here that we're going to go through is what is nephritis? And that is inflammation of the kidneys. We've got nephrons inside the kidneys, and so nephritis is inflammation of the nephrons. One of the questions here was inflammation of the bladder. Could it have been that? Well, inflammation of the bladder is cystitis. So I hope that's helped, and yeah.